So I'm curious about so many things with this. So you're right. There was this this idea beforehand that kids somehow were immune from needing medications.
That any problem, emotional problem that the child had was mother's fault. And in
Wow.
fact, during my training, the approach was quite out. Even then, I did not know much. I was in trainee. Um, they were doing when a parent brought a child, they demanded that the mother undergoes a psychoanalytic therapy for herself.
Mm,
So not parental counseling, that is what we do, kind of advising parents in better ways to manage a child that has problems, but it's kind of a psychological, largely psychoanalytic approach to treating the mother, assuming that the mother is responsible for whatever befalls the child. Really, is so outrageous. One of the first things that you may have heard me say at the beginning of supervision is never blame the mother, okay?
right. Yep. Yep.
Whatever you want to do, there is no, being a parent, as many of you are, is probably the most responsible job of our life for which none of us got training. So
Mm-hmm.
all of us, even professionals, wing it, really. So,
Mm-hmm.
but I am not a priori assuming that the mother or the father had any ill intention. They may not be uh, very good at it, but again, we have licenses to be a hairdresser, but not for parenting. Okay, so we are out there, do whatever you want. People read books, they ask advice from others, so pediatrician guiding, but some are better at it and some are not so good. I think the child is blessed when parents are competent and not so blessed when they are not. But the idea that they cause diseases, I never seen a child that develops diabetes that goes to the endocrinologist and the endocrinologist tells the mother that she fed the child too many chocolate cakes. It's
Right.
outrageous.
Right. Right.
Psychiatry not only blames the mother, but there's another thing that happened in psychiatry that's outrageous. Psychiatry is the only discipline that explained the unexplainable. Ah, I know why you are depressed. And how do you know? Okay. At best, those are hypotheses, not facts. Ah, I
Mm-hmm.
know because uh, your dog died. Okay, so you know how
Right.
frequently dog dies. 100% of the children that come to care, the dog died, parents are fighting, the grandmother is sick. Okay, I can explain away everything. I don't need to even practice anything. I say, oh, I know you are upset because of something. Okay,
Right.
none of those things are operant when somebody develops seizures. Okay, so, there's no explanation. Neurologists will not attempt to explain why do you get ill. Bad luck. No, what can you say when you get diagnosed with from little to horrible things? Ask the why. Okay. Um, no
Right.
answer. In child psychiatry, we have answers for everything, particularly if you're psychoanalytically minded.
Yes, I know. There was a presumption and arrogance to it in many ways to say, I know why. And this, I mean, there's really, for me, there was only one way to figure that out. And that was to ask the patient, so what do you think's going on?
The patient does not know why they have a problem. The patient will try to explain if you ask.
Mhm.
Most of the time, they have no idea.
Yeah,
Depression is a biological illness, not a reaction. I'm not talking about having a romantic breakup and being upset. Kind of
right.
being upset and happiness is not depression. So if you develop a depressive episode, you cannot get out of bed, and you ask somebody, look, the weather is so beautiful, there are flowers, and say, why are you depressed? I have
Yeah,
no idea, no idea.
yeah,
This kind of asking the patients is the same as I said before. You can ask the patient the seizures. So tell me, what's going on? Why you are having these strange movements
mhm,
once in a while? Try to do that and see how successful you are going
yeah,
to be. Okay, so the assumption that this is a reaction
yes,
is really an ideological passe view, with ignoring biology. There is a brain, there are circuits that misfire. So they say, you are depressed because when you ask people to explain things away, they will tell you something. And that does not should not be interpreted as truth either.
Mm. Mm. So was there a lot of resistance from the psychoanalytic community about this?
What do you think?
It's I'm a psychiatrist. I get to ask these leading questions as well. So tell me what happened.
Well, nothing happened. We did not go. It's not like the Republicans and Democrats these days. Nobody insulted me or threw eggs at me, but they thought that I was crazy.
Yeah.
The idea of medicating a child is unthinkable, unthinkable. So the idea that kind of I know why the child is having obsessive compulsive symptoms is a crippling, devastating illness. What? How can you possibly explain something that is so or Tourette syndrome? Can you imagine explaining why you are ticking and making noises? What can you explain?
Yeah, I remember when you were first teaching me about this, you used the word discouraged instead of depressed, and saying that a child, one of their goals in life, and one of my phrases is a good grade is better than Prozac. A kid who's doing well in school, they feel pretty self-confident. And I remember you saying to me, here's a kid who can't focus, can't concentrate, isn't doing well in school, and they begin to get discouraged. And that can then lead them to feel depressed.
Yeah, I think first of all, you need to keep in mind that there's a fertile. If you have genetic vulnerability to develop a condition, if that system is stressed, you'll develop the condition of interest. Okay, so it's like think about an osteoporotic. I know your viewers say, as people, women age, and not only women, men too, but it's more visible in women. The bones become fragile. It's called osteoporosis, and start with something that precedes that is called osteopenia, and that is what is targeted for treatment with some medicines that slow the process. But the point that I'm trying to say, if your bones are fragile, a small fall will lead to a fracture. What I mean, try to say is that if you have vulnerability, like say your immune system is compromised, anything that flows will get you.
Mm-hmm.
No, but not if your immune system is wrong. So if somebody has a vulnerability to develop depression, then goes to school, cannot concentrate, teachers scream at him, parents scream at him or her, they may become first demoralized and then subsequently can become depressed. The demoralization that we see is very common in adults and children. People that know that they're intelligent, people that know that they can do a job but cannot do it. Okay, it's very, very often, the most common treatment that I see in adults that were never diagnosed or treated, that is the overwhelming majority of people that I see in adults with ADHD, they are treated for complications. So they're treated with antidepressant and anti-anxiety medications.
Mm-hmm.
They say the primary care treats the complication. The patient says, I'm totally desperate. My wife wants to leave me, or my husband does not want to be with me. My boss is about to fire me. So it's a desperate situation, or I cannot finish college or whatever. So those are not producing a great feeling in ourselves. The same is true with anxiety. I think if you have a condition like ADHD and you cannot do your work, you are terrified to go to work or to go to school. How am I going to face the music in school? So those are things that very often people say that they're apprehensive and anxious, and somebody will give them Prozac. Okay, but those type of anxiety and depression that I call secondary anxiety and depression, they get much better when you treat ADHD. Although the medicines for ADHD, like the stimulants, are not treatment for depression, but by providing relief to symptoms that impair the individual, child or adult, there is a sense of well-being by being more competent, we're able to do things, not being fearful that the parents will scream or the teachers will be disappointed, whatever.
Yeah. What do you think, Mark? Does this resonate at all your world?
As my jaw is slowly lifted off the table, I'm fascinated. I'm sitting back as a listener, enjoying every morsel of this conversation. One of the things that, and I know we're coming up on a break, one of the things that was really interesting to me is when you were talking about when you first started doing this and people were presenting their children and blaming the mothers. I think that still lingers on, where at least the mothers feel some level of guilt that maybe they're not being a good mom. And Dr. Joe, if you remember Kim Barry being a normal, she talked about that present day with her experiences. And I guess how do you get that message out more clearly?
I really do not know. I think I think as Joe said, Dr. Joe said, it's discouraging. It's really, this goes on today. It's not over. I think that you know who Danielle Steele is, no? The author?
Yeah.
She wrote the only non-fiction book that she wrote. Is a very tragic. I tell all my residents that it's a must reading. She wrote about her son. She had five children. One of them was sired by a different father, the one I'm talking about. The book is called The Life of Nick Traiana. This child was difficult, problematic, kind of irritable, kind of have temper tantrum since he was born, really, literally. And she went to doctors and they all accuse her. She narrates the story. This, imagine, San Francisco, not Guatemala. She has all the resources on earth. She goes to the best of the best. And what they tell you, you write too many books, okay? She says, without anger, she writes in the book, I write after I put all my children to bed. I have 4 other children that don't have any of these problems, okay? So it must be, again, as I discussed with you before, you have to have fertile grounds to develop something, okay? It's not, things don't develop the novel. So if you have the risk, there are those genes really, if something happens that disturbs the system, and the something happened does not need to be psychological, it could be viral. For example, viruses, for example, the most common one is mononucleosis, Epstein-Barr virus, that is known to make people depressed. Of course, not everybody gets depressed, but those that are vulnerability for the menses, for example, if you are vulnerable to develop depression, your menses, the women that have much worsening of their mood, not just being a living moody, but very moody, or postpartum depression, that is a life-threatening condition. So when the hormones go berserk after partum, after delivery, so people that have vulnerability to develop this will develop this, and it's really life-threatening condition, because people can become psychotic, can become suicidal. It's a terrible problem. Certainly, the mother may not be able to take care of the baby. That's the reality. What I'm trying to say is that we have to be very, very careful, and I think that explaining things contributes. And one of the easiest explanation is to tell that the mothers, if the child has a cold, the mother will say, oh, I forgot to put the hat, okay? They don't need to tell for the dog. It's like when you say, I am stupid, and your interlocutor says, yes, you are stupid, me too. And so the idea, they go to the doctor for help, the doctor tells them, all your fault, okay? It's very, very exciting.
It is so easy to point fingers and blame others at these things. But one of the things that will happen to me is I will be blamed by our sponsors if we do not take a break.
Absolutely.
We are going to take a break. We'll be right back with Dr. Biederman. We'll be right back.
Stretch the cat.